Well, welcome everybody. Appreciate you joining us today. We're excited to share with you the Sedera Access individual program options combined with the SHA, the Shared Health Alliance program. And it's such a breath of fresh air right now. We've kind of struggled with at times the relationship with the faith-based health share programs that are out there, and the fact that either A, they don't want a connection with any insurance agents, or B, they're just sort of hard to enroll in sometimes with some of the faith-based aspects of the questions that they ask, or even some of the minutia that has to be performed to get enrolled. And so the fact that we can now add Sedera not only on the employer side, but also an individual option. The timing is perfect as we head into fourth quarter. For that discussion, I have Julie Silverman again joining me, the regional sales manager for Sedera. Julie, thanks again for joining us today.
Yeah, thanks for having me, Corey. I'm happy to be here.
Well, again, I appreciate it. We're very excited about the part with you in order to, of course, again, use our time efficiently and not keep our distribution on the line too long. Let's dive right into what Sedera has to offer on the individual side here.
Great, thanks so much. So some of you may have heard of Sedera's medical cost sharing for employer groups, Sedera Select. Today we're going to be focusing on Sedera Health for individuals, folks out there that don't have access to affordable health care. So today we'll be talking about Sedera Access, geared specifically for those folks that really don't have too many options. Maybe they're a 1099, a contracted employee, and really just don't have a good option when it comes to healthcare. And I think, one of the biggest differences between Sedera Select and Sedera Access is actually the enrollment process. And, we're teaming up with SHA to provide you all a enrollment and billing platform to be able to take on these individuals that are looking for an overall solution. Because we are not an insurance company, we legally cannot hold and take in funds. And so by enrolling folks through SHA's platform, you're able to have a way to collect payment for the monthly costs associated to SHA and Sedera, a nice overall solution in terms of customer support for your members, and really just a nice way to enroll into the Sedera community. So again, we look at everything in terms of a need, and we'll talk about what a need is for Sedera members. A need is one or more medical expenses caused by a single accident or illness. Each member will choose their initial unshareable amount. We call it an IUA for short, and that's what the member pays before sharing begins for that need. Needs over the IUA and Sedera Access members have a wide array of options to choose from: the $500 IUA, the $1,000, $1,500 IUA, the $2,500 IUA, and the $5,000 IUA. Needs that are over those amounts are fully shareable with the community. So we'll talk about what this looks like for our members, and I'll use myself as an example. I have the $500 IUA with Sedera. Let's say I'm at home, I'm on the ladder, I'm cleaning out my gutters, and I fall down. I fall off the ladder, I break my leg, I have to take an ambulance ride to the hospital. I need x-rays once I'm there, crutches, and eventually physical therapy to heal from the accident. So my responsibility is the first $500. When I get to the hospital, the doctor's probably going to say, well, Julie, do you have insurance today? And my response would be, for this visit, I'm self-pay. I'm a cash pay patient. You can take up to $500 for my Visa card. Please send me the bills for the rest. So it's my responsibility to collect my bills as they come in, upload them using the Sedera app, or I can email them over, whichever is easiest for me. It's possible that my bills that are over $500 will be sent to our parent company, the Caris Group, to be negotiated down on my behalf. Sedera will then facilitate the sharing amongst the entire community, send me a check, and I will pay back the provider, the doctor, the hospital. So again, I'm self-pay. I'm a cash pay patient when I get to the hospital. I collect my bills, get them to Sedera. Sedera facilitates the sharing and sends me a check to pay back the provider. And then the last thing I'll note on this slide is that we are ultimately trying to limit your out-of-pocket costs. If you're a member only on Sedera Access, the most number of needs you could have in a membership year is 3. And if you have any dependents on your membership, the most number of needs you could incur in a membership year is 5. Anything else after that point would be a $0 IUA. You know, Sedera is saying, Julie, you've had a rough year. You've had 3 separate incidences that you had to pay your IUA. Just send us your bills. We'll share them at first dollar. So let's talk about another real life example. I like this example. It's our CEO, Jamie Lagarde's example. He has 3 little boys at home. His youngest son, Brooks, was having persistent ear infections. At the time, they had a $5,000 family deductible. Little Brooks had to see several different doctors. They tried antibiotics, booster injections. Eventually, he needed to have surgery to insert tubes into his ears. So on the left-hand side, you'll see the copays, prescription costs, in-office injections, and eventually the surgery, roughly $2,500 out of pocket. Now, had he been a Sedera member at the time, he would have paid the first couple of office visits cash or used his SHA mech to take care of some of those small dollar items. When it came time for surgery, he would have paid the $500. The rest would have been shared with the community. Now, this actually happened in the fall. The following spring, the tubes fell out of little Brooks's ears, and they had to repeat this process all over again. And as we all know, deductibles reset at the end of the calendar year. So Jamie was looking at another $2,500 out of pocket. Now, had he been a Sedera member when the tubes fell out, he would not have had to pay another IUA because little Brooks would have had to go 12 months without symptoms or treatment for it to be considered a new need. So when the tubes fell out that spring, he had already met his IUA of $500. The reinserting the tubes would have been fully shareable with the community. So we're going to talk about how we handle pre-existing conditions for Sedera Access members. Again, the common pre-existing conditions, these items, when well controlled, there are no sharing restrictions. So high blood pressure, high cholesterol, sleep apnea, and non-insulin dependent diabetes. No sharing restrictions there. For everything else, we consider a condition to be pre-existing if a member had observable symptoms or had received treatment in the 3 years before joining Sedera. So if everyone was going to join Sedera January 1st, there's a 3-year look-back period. Anything that a member had observable symptoms for or received treatment for, the following sharing rules would apply. In year 1, there'd be no sharing for that specific condition. Year 2, we would share up to $15,000 for that specific condition. Year 3, up to $30,000 for that specific condition. And the 4th year, it would be fully shareable with the community. And then the note there is, even in year 1, Sedera's member services team is available to assist our members in locating cost-effective providers and alternative services, and we're still available to negotiate medical bills that exceed $500. So lastly, I'll just touch on our member services. So all Sedera members that join get access to Second MD. Second MD is a network of the nation's top doctors at centers of excellence, places like Johns Hopkins, MD Anderson, the Mayo Clinic. They're there to provide an expert written second opinion. Some of the common reasons someone might reach out to 2nd.MD, maybe they received a new diagnosis that they're unsure of, maybe they're being told they need to take a new medication, or perhaps they're being told they need to have surgery. These are some examples of when you'd reach out to 2nd.MD at no cost to Sedera members to provide a written second opinion. I am just going to talk about any non-emergency surgery that is being scheduled out. We do require that our members reach out to 2nd.MD to get that second opinion. And we do that because 2nd.MD did a study finding that over 30% of surgeries are unnecessary. There are better treatment plans out there before going down the path of surgery. And so just by reaching out to 2nd.MD for that second opinion, if you're being told you have to have any type of non-life-threatening surgery, we will reduce your IUA by $250, and your treatment would be shareable with the community. Anyone that does not reach out to 2nd.MD for a second opinion when they're being told they have to have surgery, we will reserve the right to only share up to 50% of that surgery cost. So we think it's worth it just for you to get that second opinion, whether you go through with it or not. We ask that you reach out to 2nd.MD. We've also built in 3 hours of professional counseling support for all of our members. And lastly, everyone will have access to our team of personal member advisors that are in-house here at Sedera in Austin, Texas. Maybe you need help price shopping for a medication. Maybe you need help finding a doctor in your area that specializes in something. Or maybe you're just new to being a cash pay patient and you want to talk to someone before you go see the doctor. We have a team that's here to support you, best navigate being a Sedera member and being a cash pay patient. So with that, I'm going to turn it over to Corey to talk about the combined offering with SHA and Sedera for individuals.
Yeah, thank you, Julie. It's again, the progress and the process that we've gone through to get here and get a combined program, or at least create a combined billing solution and enrollment portal. It's taken some time, and now we feel like we're in such a great place now that with Sedera, we have a non-faith-based solution that also incorporates the SHA-MEC options. And unlike the group options, if you've seen the Sedera group options, we've got some additional IUA options to help be competitive with some of the other health share entities out there that are out there with, 3,000 and 5,000 sharing amounts. So you'll see that as we go through the structure here. The SHA plans are still incorporated into the enrollment portal and into the Sedera solution, so the members still have access to the first dollar type benefits that SHA provides, as well as the RX, and then the catastrophic reimbursement that comes through part of being a part of the Sedera community. We do perform the consolidated billing, so to your clients and customers, your prospects, they get one bill, one premium collection or monthly cost solutions, so they don't have different places where they're having to make a payment or pay their bill. And then certainly there's a warm transfer for those bills, those medical needs that go beyond what the SHA program covers or reimburses for. So our TPA can then transfer your clients over to Sedera when it becomes a medical need that's more catastrophic in nature. Again, most of our distribution is familiar. You are familiar with the two different SHA options, the Premier option and the preventive option. Certainly, those are both MEC options. As the individual mandate appears to be going away, it certainly is less of an issue as well. When we get into 2019, we'll see how long that lasts. And the benefits that are offered through Shared Health Alliance still become very valuable to your customers and to your prospects. The preventive plan is a basic MEC plan that also includes access to the zero copay telemedicine program, as well as the Sharks RX advocacy program and the drug card. So that piece alone. One of the areas that is challenging for the health share programs in general to fund for is the high-cost specialty meds, the high-cost maintenance drugs. So as many of you already have become familiar, the Victozas, the Humalogs, the Revlimids, the Remicades, Humiras, Harvonies, you name it, these high-cost medications we're getting to our members typically at no cost through the Sharks program, if not at a very low cost. So that's in the preventive plan. And then the Premier plan adds in the copays, which you're probably well familiar with for the various services. And then it still has the telemedicine and the RX program. So both of those options are combined with the Sedera programs. And you'll see that when we get into the enrollment portal that we've made it pretty easy to identify which plan options you're selecting. So a little bit more on the Sharks program. Again, most of the members are getting their prescriptions for free. The ones that we're not getting at no cost, the members are paying what would be equivalent to a copay for the international or the wholesale mail order programs or some of the donor programs that we use. The expensive name brand medications, the high cost specialty meds. So when you've got a diabetic that's basically insulin controlled but otherwise healthy, health share might not have been an option for some of those folks to consider. But because we're able to get them their Victoza, their Humalog, or some of the high cost medications where it doesn't become, oh man, I'm joining a program that I don't have a drug card for and I don't have access for. You can help eliminate that objection and still get that member into a much more low-cost alternative like Sedera and get them access to their prescriptions through the Sharks piece of it. We won't go through all this pricing, but you'll see a couple of grids. This is the SHA preventive pricing, including the Sedera programs, and you'll see 5 different IUA options ranging from 500 up to 5,000 IUAs. That's the individual unshared amounts. And the access programs are age banded. You see the age bands go from 18 to 29, and then 10-year increments 30 to 39, 40 to 49, up to 60 to 64. So you can see those. You see how the price is broken out, and the combination here includes the SHA preventive program and the Sedera program. So the next page of this will also show you what the Premier pricing looks like. And when we take you through the enrollment portal, you'll see when they click on the appropriate plan design, it will show the member based on their age how much each of the IUA options is. So then in that case, they're not looking at 25 or 30 different sets of rates on a page. Another thing that we do like about Sedera, obviously, is you have an option to give tobacco users a health share option. The ones that are over 50 do tend to have less, some lower limits on some of those conditions that could be related to tobacco, but where you might have had to turn them away in the past, you're not having to turn those people away with the Sedera program available to tobacco users at an additional cost. So if we may, and many of you may have requested or you've already seen a little bit about the enrollment guide, but we did want to give you a picture of what the enrollment guide looks like using the SHA and Sedera solution. So as we keep going here, you'll see that on when you select the plan design here, you or your client will first take the time to figure out the plan options that are available and the premium information. And then they'll select that blue button that says enrollment. So once they've clicked on that and reviewed, then the next option that would come up would give them the spot to fill in the date of birth for the oldest member on the program, whether it's the husband or the wife or whatever, if they're both enrolling, the oldest member's birth date. And then it's really important to select whether they are a tobacco user or not. Any of them are tobacco users or not. So then the drop-down box comes up to enter the additional information. So we've gone to the next page there, and you're going to start to see the various options come up. So when we've selected Premier in this case. Now you or your client will see all of the different options that come up under Premier and the pricing. So first starting with a $500 IUA for an individual, then $1,000 IUA, $1,500, $2,500, $5,000. So it's at least the screen has minimized it and excluded some of the other age bands. So now, hey, if I'm just enrolling a single person, I can look at those first 5 IUA options. Say, oh, there's the one I want. Select 500, select 2,500, whatever. Or if they've got family, then they would just scroll down and look at, do I have a spouse? Do I have children? Do I have a full family? And it will be set up based on that oldest member's age will dictate what premium elections come up there. So now they've got hit the green checkout button. On the personal information page, what we're essentially collecting at this point is billing information. So you're going to see only personal information requested on that primary member. And so you're not, if they've selected family coverage or children, they're going to add their children, you're not seeing a request for that data here. I'll get into why in just a little bit more here. So you've chosen the effective date. You move to the next screen, or you scroll down, you continue scrolling. And so then the banking information that many of you have already seen from enrolling members in the past. And so you've checked that box that says you acknowledge and understand the terms. Again, step 9, you select the method you'd like to e-sign. So at that point, you're filling in the cell phone information of the member and the email address, and then clicking send for which way you want to get the electronic signature verification. So if I plug in my cell phone number and hit send, and then now I've gone to the next page, and you've submitted that, now a message will pop up, and sometimes it takes a couple minutes for that authorization to go through. And so it says they're waiting to receive the signature box will appear. So now you've gotten a signature verification either sent to your cell phone or to your email. So once you get that waiting to receive, you've hit submit order. And then what should pop up next is the option to open the link in your text message or your email to complete the e-signature. So review the information and confirm everything matches. Review the terms and conditions and the payment method. And then your client will sign with their finger or whatever on their mobile app or with their mouse on their computer. And again, hit the red button for accept. And that will finalize and take them to step 10, where once you get that message that the signature document has been received, then the final button is to click submit. And so you've submitted that order. Now Sedera will then, Julie, I believe at that point, Sedera sends the enrollment confirmation, or we get confirmation, but to the member that they've enrolled in the Shared Health Alliance piece of it. Now Sedera is missing some information. So the Sedera enrollment will happen at that point. And the reason that we didn't ask for the personal information from the spouse, for the spouse and the kids and the Social Security numbers, is Sedera is going to collect all that. So instead of having the member have to fill that information out twice, we've elected to wait until the Sedera application process is requested, because not only do we need the socials and the date of birth for all members, but there's the health questions that need to get filled out, and then certainly the attestation of the Sedera's, the principles of membership, or some would call them the statement of beliefs. Julie, anything that you'd like to add just on that process of the Sedera enrollment coming through?
No, I think that's great. And we have been working hard to make the second portion of this that, when they get that text from Sedera to complete the rest of the information, dependent information, answer the health questions. It's all done on a mobile device, which makes it pretty easy to sign off on the principles of membership. It gets the member familiar with how they will be communicating with Sedera, because again, that app where they're going to be completing the final steps to the enrollment is where they would go to submit a need. So I think having them finish it up on the Sedera web-based app on their mobile device is going to be extremely helpful for them to get familiar with if they ever were needing to submit a need.
Perfect. Well, if you have any questions about how the Sedera enrollment process or the SHA enrollment process works, certainly shoot us a note. I think that we've got this PowerPoint or this slide deck ready to send out to you. So if you don't have this and you'd like to get a copy of the enrollment process, please let us know. The great news is we are ready to enroll new members effective 10/1. I know some of you were concerned about getting ready to move your clients or customers that are enrolled in the ALERA program that we had last year as a non-faith-based option. And they're making some TPA changes that are going to mandate that essentially that the product as it stands now won't be available after 1/1. Great time to move your ALERA members over to Sedera. We're ready to go. And Sedera obviously offers an unlimited reimbursement amount. Correct me if I'm stated something wrong there, Julie. And because of that cap with ALERA, sometimes their price points were a little bit lower, but your members were getting a lot less access to medical need reimbursement under the ALERA scenario. So now non-faith-based health share community program through the Sedera Access single source enrollment portal, ready to enroll for 10/1. The contracting piece would probably be the last piece for those of you that haven't done that yet. Shoot me an email, shoot John an email, shoot our member services information email requesting contracting, or certainly feel free to email Julie at the email above and get the contracting going for your Sedera piece so you can get your individual enrollments ready to go for Sedera for 10/1 and beyond. Should be in a great place price-wise and with the multiple options that Sedera has put together for us. It took us a while to get the enrollment portal get it put together. We've tested it out. It works great. Great cooperation with Sedera. We're enjoying the relationship that has developed there. And Julie, thank you for taking the time again. Anything else you'd like to add before we close this thing out?
No, I think that's great. And if anyone does have additional questions, you're welcome to reach out to me directly. I'm here to support you with questions you have as it relates to Sedera. And as Corey mentioned, let us know if you still need to get appointed. We'll send out the training so that you're ready to go to represent Sedera to your clients.
Excellent. Well, Julie, thank you for going down this road with us and the process and taking the time to get everything set up. Appreciate the efforts on Sedera's end, and looking forward to kicking this off at a high level here. So once again, let us know if you have any questions out there, and look forward to partnering with you all with Sedera. I think you'll find it a breath of fresh air to be able to have access to the health share entity for your clients and actually get paid an additional commission to do so. So thank you all for joining us. We look forward to working with you. As always, thank you for your partnership with us.